Assalamualaikum warahmatullahi wabarakatuh. I bid to our respected lecturers, Sir Nazrul Hadi, and to our fellow friends. Today, we are going to talk about one of the vitamins, which is vitamin D. This is the list of our group member. Without further ado, let's get started. To begin, what exactly is vitamin D? Let's learn together. Vitamin D, also known as calciferol, is a fat-soluble vitamin that dissolves in fat and oil and can be kept for a long time in our body. It can exist in two isoforms, which are D2 ergocalciferol and D3 cholecalciferol. Vitamin D2 is mostly produced by humans and added to the meals, while 7-dehydrocholesterol is used to make vitamin D3 in the skin. Vitamin D3 synthesis can be activated with the exposure of bare skin to sunlight. Vitamin D3 can be obtained through the consumption of animal-based food. Commercially, synthesized D2 and D3 are present in fortified food and dietary supplement. However, due to the better ability of binding protein towards vitamin D3, vitamin D3 is said to have stronger blood stability than vitamin D2. Next, dietary vitamin D can be obtained from three sources, namely natural food, fortified food, and supplement. There are a few naturally occurring food sources of vitamin D, which include fatty fish like salmon, tuna, sardine, herring, and mackerel. Egg yolk and mushroom also are examples of natural food that contain vitamin D. Commercially, vitamin D is fortified in cereals, bread, butter, and yogurt. Beverages such as milk, soy milk, and orange juice are also fortified with vitamin D. Moreover, vitamin D dietary supplements, either combined only with calcium or with multivitamin formulations, have become more common. Cod liver oil is also a popular supplement. In addition, direct sunlight exposure to the skin is also a good source to achieve the optimum level of vitamin D. Next, according to the RNI 2017, infants aged from newborn to 12 months should consume vitamin D 10 microgram per day. They may get that from breastfeeding or formula milk. For children, adolescent, adult, and older adult, the recommended intake of vitamin D is 15 microgram per day. For children and adolescent, vitamin D is very important to ensure normal and healthy bone accretion. Meanwhile, bone maintenance is the focus for the adult stage. Pregnancy and lactation mom also need to consume 15 micrograms of vitamin D per day. The elderly, on the other hand, should consume 20 micrograms of vitamin D per day for the reduction in fracture risk.
Now, we will move to the function of vitamin D. First, it helps promoting healthy bones and teeth. Vitamin D plays a significant role in the regulation of calcium and maintenance of phosphorus levels in the blood. We need vitamin D to allow the intestine to stimulate and absorb calcium and reclaim calcium that the kidneys would otherwise excrete. Vitamin D helps supporting immune, brain, and nervous system health. Vitamin D can decrease an individual risk of developing osteoporosis, hypertension, cancer, and several autoimmune diseases. Studies also report that it triggers the body's immune cell to produce antibodies. The third one is it can help to treat hypertension. For your information, even short-term vitamin D deficiency may directly raise blood pressure and promote target organ damage. Number 4, vitamin D may help reduce the risk of certain cancer. According to National Cancer Institute website, it provides some evidence that vitamin D may have a cancer-fighting powers. Evidence is increasing that vitamin D supplementation may improve cancer outcomes. The cancers for which the most human data are available are colorectal, breast, prostate, and pancreatic cancer. Last but not least, vitamin D helps to regulate insulin levels and supporting diabetes management. For your information, vitamin D helpful for preventing both type 1 and type 2 diabetes.
Lastly, let's proceed to vitamin D deficiency. There are some symptoms that show vitamin D deficiency in your body. First one is fatigue. Feeling tired can have many causes, and vitamin D deficiency may be one of them, as vitamin D is key to build strong bones. So, lack of vitamin D can cause bone and muscle weakness, which lead to fatigue. A study from National Institutes of Health found low levels of vitamin D were associated with poor sleep quality. In short, if your vitamin D levels are on the lower end, you might sleep less, and even when you do sleep, it may less efficient. So what? So you will be sleepy the next day. Next is bone and back pain. Vitamin D helps the body to absorb calcium, which support bone health. However, inadequate vitamin D may cause muscle ache, weakness, and bone pain in people of all ages. In adults, the bones, particularly the spine and leg bones, are weakened. Third one is mood swing. A depressed mood may be a sign of vitamin D deficiency. Low vitamin D level presents similar symptoms of depression such as anxiety, feelings of helplessness and sadness, loss of interest in previously liked activities, and suicidal thoughts. Therefore, people with depression may have lower vitamin D levels, but the deficiency did not cause the illness, since these people spend less time outside, which they lack of sun exposure to process enough vitamin D, or they may not eat properly, which lead to vitamin D deficiency. Besides, vitamin D deficiency may result in complications. For instance, autoimmune disease. Vitamin D is a natural immune modulator that regulates activity of T cells, preventing inflammation and autoimmunity. However, low levels of the vitamin D may be connected to autoimmune disease, including diabetes mellitus and rheumatoid arthritis. Vitamin D deficiency may result in cardiovascular disease, which increase risk of heart disease, stroke, and hypertension. Obesity is an important risk factor in cardiovascular disease. This is because vitamin D is a fat-soluble vitamin and being absorbed by fat cells, which keep it from circulating throughout the bloodstream. As a result, obese or overweight people will have low vitamin D levels. The last complication of vitamin D deficiency is cancers. Inadequate intake of vitamin D may increase tumor invasiveness and propensity to metastasize, which lead to cancer mortality. Low vitamin D intake has also been indicated in patients with breast, colon, and prostate cancers.
Here is the list of our references. Thank you for watching.